All right, so we'll get started, everyone. Hello, bonjour, bienvenue. Welcome to the French Language Health Services Community of Practice for the Hamilton, Niagara, Halton, Brant, and Waterloo, Wellington regions. First webinar for this year. We're happy to present to you the eQUITY Link platform, a comprehensive guide to planning and implementing French Language Health Services in partnership with the French Health Network of Central Southwestern Ontario. We're very happy to present to you this platform today. We're very, very excited to be joined by Geneviève Laferrière, who will be presenting on the platform today, who is a project coordinator with the French Health Network of Central Southwestern Ontario. If you're joining us and you're eating lunch today, bon appétit, and we hope you enjoy the webinar. My name is Chloe Eward, and I am a health planner with Entité, French Language Health Planning Entity for the HNHB and WW regions. And I'm joined today by my colleague, Annie Boucher, who is also a health planner, and as well as my colleague, Maryse Gauthier, who will be helping us with some technical and administrative help today. Before we jump into the webinar and have our lovely partner Geneviève present the platform, I will be introducing the FLHS community of practice, our initiatives, as well as the entity. And before that, I do have a few logistical points. We will be taking questions in the Q&A part at the bottom of your screen or the chat. My colleagues Annie and Maryse will be monitoring these. However, we will be answering these questions at the very end of the webinar after a presentation by Geneviève. So to begin, we'll jump right into the French Language Health Services, COP. So what is the HNHB-WW French Language Health Services Community of Practice, and how did we come to be? How did we start? So on the right side of your screen, on the slide here, you can see our two regions, so Waterloo, Wellington, as well as Hamilton, Niagara, Halton, and Brant. And how we came to create this community of practice is essentially back in 2019, the LIN, the Local Health Integration Network, asked us to conduct some gap analysis. And so we conducted this gap analysis in consultation with identified health service providers back in 2019, which revealed some gaps such as mostly just an understanding of what an identified provider had to complete versus a designated provider and what their obligations were, as well as what kind of resources are available within the community and what the entity does. So we essentially in 2019, as part of our LIN entity annual plan, we created this French Language Health Services with our steering committee, and with a purpose to increase competency in providing active offer, spread French Language Health Services best practices, improve system navigation for Francophone clients and families, as well as support bilingual human resources, recruitment, and retention. So members of our steering committee include currently the Ontario Health West, Alzheimer's Society of Niagara, as well as Alzheimer's Society of Hamilton, Hospice Niagara, Victorian Order of Nurses, the Translation Network, Fairview Seniors Community, as well as Entité. And a little bit more about Entité and what we do. We are a French language health planning entity for the Hamilton, Niagara, Halton, Brant, as well as Waterloo, Wellington communities. What we do is we engage the Francophone community and stakeholders, inform and consult. We support planning at the local level, for example, with local health integration networks and now Ontario Health West, as well as Ontario Health Teams. And also planning, we also support the planning at in provincial strategies. And finally, we guide and educate health service providers to build capacity and improve the delivery of French language health services. So essentially, entity is right in its park activity park in terms of the French language health services community of practice and what we do and what we're trying to promote through our activities, such as this webinar today. A little bit about our recent activities and projects. They're listed right on the left part of your screen. First, we did have a webinar on active offer training. These recordings and information is available on our website. We also have had in the past a webinar with the Translation Network, and the recording and information is also available on our website. And the website that I'm talking about is actually our community of practice website, which is accessible through the entity's main site. And there's a tab that is called Community of Practice. You can also access this website just by scanning this QR code, the first QR code on your screen. If you're not sure how to use QR codes, as I wasn't 100% sure at first, you can actually just swipe up and use your camera to scan this QR code, and a link will pop up at the top of your smartphone screen, and you can click on that link. You can also access it just by going on our website again, or by punching in the URL that is on right beside that QR code. The COP website hosts a variety of French language health services resources and information for health service providers on how to, what identification is, what designation is, health human resources strategy, recruitment, and such, as well as active offer and many other resources. On this website, we also have started offering membership, which essentially just allows you to receive updates regarding the release of new information, automatic invitations to community practice events and activities, as well as the ability to learn from other health service providers alike. And here's another QR code on the bottom of your screen. Same thing, you can just swipe up, use your camera, or as well, you can also go on our website and access the membership link through the website. So without further ado, I'd like to present to you Geneviève Laferrière, who's the project coordinator for the French Health Network of Central Southwestern Ontario. She will be presenting the platform eQUITY link. There's a mini bio below, but I don't want to delay our presentation anymore. I'm really excited to present to you this platform, and we really hope that you enjoy the webinar. Again, feel free to place your questions in the Q&A section or in the chat, and we will be monitoring this to answer these questions after the webinar. So welcome, Geneviève. I invite you to share your screen.
Thank you so much, Chloe, and thank you to the community of practice and the entity for inviting me today to present the eQUITY link platform. Now, can I just get a confirmation that everyone can see my screen?
I'm good on my end, Geneviève.
Perfect.
Yes.
Thank you so much. So yes, we are very excited today to present this group with our new online resource that was developed by our national organization, Société Santé en Français, with us as a project lead, along with various collaborators across the country. But before we start, I wanted to launch a little poll just to get a better idea of why you were interested in participating to this webinar today. So I just want to get a better sense of what are your motivations for participating today, whether you are mandated to offer French language services, or if you are looking to address the needs of the Francophone community but aren't sure where to start, whether you have a key role in planning French language services within your organization, or whether it's for personal or professional interest.
Thank you, Geneviève. Thank you, everyone. I'm just going to close the poll now and share the results with you.
Wonderful. So 38% are actually mandated to provide French language services and are looking for implementation strategies. And then the second largest group are people who have a key role in planning French language services within their organization, followed by personal or professional interest, and then those who aren't sure where to start and wanting to meet the needs of the Francophone population. Thank you so much, Chloe, for sharing. And thank you everyone for participating. So we hope that today we'll be able to provide you with some of those strategies that you are looking for, and offering you a broader view of where to get this information that can be tailored to the needs of your organization. So eQUITY link, which you are currently seeing through the shared screen, you can see the launch page or the home page, is a resource site or sort of a hub for health service providers to help build the linguistic competency of diverse health systems. So it is made to be adapted to help organizations across the country, but we'll show how you can receive guidance when it comes to your specific region. So it offers evidence-based validated tools, tips, and strategies to help guide health service providers in the planning of the delivery of French language health services, and also to build their French language service capacity. And the resources are adapted to meet the specific needs of minority populations. So as you can see, this is an entirely free website, although if you see, you do need to register. So I currently have our test account open, but registration is free. All you need is an email address and a password, and you can access the site at equity-link.ca. You will be receiving a copy of a few slides of a PowerPoint and a briefing note with included links to help you guide you through this process. So once you've registered for your free account, then you can log in and access our different resources. So if we are going to the resources page, we can get a better idea of the different resources that are available based on your need, whether you are more a member of the workforce or frontline service worker. So obviously we have the link to the active offer training that's available online, which I believe most of you are already aware, and that the entity has done a previous webinar on this topic. If you are an organizational representative, and here we will be delving in deeper into the equities fundamental, which is the new resource. And you can see that we also have the health human resources strategy included there. Although the equity fundamentals resource links in with these different resources. But we wanted to offer that flexibility to either go through different themes or to get an overall view. And then whether you are a health authority, we have other resources, and we encourage people to visit often because we will have new resources that will be being made available over the next few months. So we've sort of addressed who the website is for, and really what we are trying to do is bring those resources together in one centralized location, and offer you that personalized or the flexibility to go at your own pace, determine which resources are best suited for your needs, and offering obviously the tools and the support for French language service delivery and to address your specific challenge areas. So that sort of gives you an overall of the website, and there are more information if you're interested. But when speaking with Chloe and Annie, they really wanted to highlight this new resource, which is Equity Fundamentals. So it is meant to be a guide to help health, social, and community service organizations offer safe, quality French language services to Francophone populations in their catchment area. So we will go into the site or into this resource. And when you first access the resource, you will have a little button right here under content that says take this course, which you just need to click once to access all of the information under the chapters. So the we'll just go here under introduction quickly. And I apologize, I think my internet's a little bit slow today. So when we are in the content, you can see that, so equity fundamentals, what is it meant to do? And really, it is to help organizations know where to start or know what their next steps are meant to be. And it focuses on 4 key areas that are built on based on a cyclical approach for quality improvement. So making sure that you understand the needs of the Francophone population and your organization's current capacity, that you plan your organization's French language services with the right stakeholders. So making sure we have that community engagement happening throughout the process, that you're implementing key strategies based on the 5 principles of equity for French language services, which I will touch upon very shortly, and then that you evaluate your organization's progress. So the 5 principles of equity that we delve into further in the implementation section touch upon active offer, clinical research, which is, I understand, only touches a few, like certain organizations that do clinical research, mostly research-based hospitals. But we wanted to offer that cumbersome view or overall view of the different areas that need to be addressed when it comes to French language services and ensuring adequate representation of the Francophone community. And then we touch upon governance and leadership, workforce, and quality assurance. And those 5 principles have been are based upon Accreditations Canada their recognition program for access to health and social services in official languages, because it does provide national standards for organizations to strive for, but we will also demonstrate how we have aligned the recommended strategies with the Ontario's designation plan and evaluation tools. So just based quickly on this overview of understand, plan, implement, and evaluate, I will ask Chloe to launch the second poll, just to give us a better idea of where you think your organization is within this process, whether you are currently in the process of understanding the needs of the Francophone population in your current capacity, whether you are at the phase of planning, so prioritizing strategies and actions to implement and develop your French language services plan, or whether you're currently implementing various actions with regards to active offer or Francophone representation, etc. Or if you have various French language strategies that are currently implemented and you're more in the process of monitoring your progress, or if you're currently not sure.
Okay, so we have about 80% respondents, so I'm just going to end the polling and share the results.
Okay. Wow, that's wonderful. So most people, 20% of participants say they've implemented various French language services strategies and they're monitoring their progress. Then it's a tie for whether we're currently assessing the needs or implementing various actions or unsure, and then followed with people who are currently planning their process. So thank you so much for everyone for participating. It's very interesting. And so I'll try to tailor where we're sort of delving into the different sections based on your current situation. So this once you've, so the equity fundamentals allows you to navigate according to your current status. So you can follow it step by step, but it's really made to be so that you can tailor it to your needs and go to the direct section where you feel you need the most support. So I just wanted to show that we can, you don't necessarily have to go through each step before you go. You can jump to evaluate or to the different sections. In one of the key features that we wanted to provide for guidance, no matter where you're situated in your French language services journey, is really to help organizations with a self-assessment to really establish a key baseline of where they're currently are at, and what would be the recommended next steps. So we've developed a self-assessment that are based on the various criteria of the standard, and Accreditations Canada's recognition program, in a simplified version, to basically get an overall picture of where organizations are, just to help with that additional guidance. Because that's what we are trying to do, is help the most organizations help actively offer French language services. So just to give you an idea of what that self-assessment, so we always have a button available in the right-handed menu or at the bottom of the section that I was just showing you. And here I have an example, but if I want to show you this self-assessment, this is the tool. So you write your organization's name, and it could be for an organization, a department, a specific service or program. So feel free to tailor it to your needs. And then we just have a few statements. So it takes about 10 to 15 minutes to complete. And we offer in the section explaining the self-evaluation, we offer a PDF version that you can print out, because we do suggest organizations, because some people might not be aware or able to answer all of the questions. If you do it through a small working group, it might be easier to note the answers and then input them in the system. And just to let you know that all of this information is entirely confidential. No administrator, no other users have access to this information. It is really just meant to help organization, and it is not, it is there to help guide, and it's not part of any reporting requirements. So once you've completed your self-assessment, here, just let me go back quickly because I've already completed one for you. Sorry. I apologize, I'll just go back quickly because I don't want to submit a new blank form. In sharing a full screen, I've lost my going back and forth tabs. So I just wanted to show you a completed version. So you can have different versions of the self-assessment, or use it to track your progress. And once you've performed your self-assessment, so I will show you first of all the baseline data. So this is what you obtain for information. You know who the author is, when the plan was developed, when it was last revised. And so you always have access to your baseline data, unless you decide to erase that version and then the oldest version of the work plan becomes your baseline. But it's really there to provide an overall glance of actions that have been completed, what's currently in progress or not started. And here we can see that clinical research is, since it's not applicable for this organization, there is no data being inputted, but it will remain there as an inactive component, just to allow for future growth, or if that's something that might become part of your organization as activity in the future. So you have the graph and the table to show those results. And then you can go and develop your work plan based on those recommendations. So if we go to the work plan, the first section asks for organizational strategies and your objectives for French language services. And really it's there to make sure that there is alignment with your overall strategic directions, mission, values, and visions of the organization. And then you can go step by step. So based on your self-assessment results, you will see your completed strategies. So yellow being things that are currently in progress, things that have not been started, and including your completed strategies. For these incompleted strategies, you'll see that the status has been auto-populated based on your self-assessments results. If you want more information before you look at which activities are being chosen or prioritized for that specific strategy, here's where we link off to I apologize, to the content in the website, where you will have access to the different strategies that are recommended. And then you can look at what information is required, the different resources, and be able to prioritize. Sorry, I'm just going to go back like this, to prioritize your activities to build your personalized French language services plan. So then you can input the activities, we can switch things eventually, and use this as a reporting tool to show that it is a completed action. And then we can save, and I will jump to, here we'll go to workforce. So you can move around in this tool, use it to identify things that you will be currently working on over the next 12 months, and then use it as a reporting tool just to follow and track your progress. And again, here, if you want more information with regards to this strategy, it'll open a new window and send you directly to the specific sections where you can access the tips, the resources, whether they're national or more local. And here we demonstrate how it does align with HSO's standard for offering health and social services in official language, which is part of the Accreditations Canada's recognition program, and then how it also aligns with the Ontario designation plan and evaluation tool. So, there is quite a bit of content, and it really is there to help you sort of establish your baseline, and you get access to your instant results. And as I mentioned, the data is entirely confidential. And then you it helps you navigate the different sections that are really just relevant to your own organization. So whether you are at understanding what the needs of the Francophone population are in your area, or if you are, looking at the different strategies with regards to active offer, governance and leadership, workforce, quality assurance, or looking at different areas to help with evaluation. And we do provide some guidance with regards to different indicators that can help you track your progress. And we also give an idea of who is responsible for the work. So whether it is members of the management team or Francophone or Acadian population representation, people who are responsible for French language services, human resources, communications, or quality and risk management. And it's really in the implementation section where we sort of divide the work more amongst those different representatives to help make sure that it's taking into small steps and that everybody can be helping to move things forward without being too much work just for one person within an organization. So I could talk about this resource for quite some time, but I do want to make sure that we have enough time for Q&As and we can continue. I can pull up the site again, but I think at this time we will stop the screen share and launch sort of a final poll to get an idea of if you think that this resource could be a support for your organization, and then sort of go more into a roundtable discussion to answer your specific questions. So I know it was a brief overview, but we just want to get your first impressions of the eQUITY Link platform and of eQUITY fundamentals, whether you can see yourself or someone in your organization actively using this platform to assist in your FLS efforts, where you think that some resource or tools could be helpful, or if you see that this platform as being something that would be helpful, but you might require further assistance, or if at the current moment you're not unsure how your organization could use this platform.
Okay, so we're about 80%, seems like it's slowing down a bit, so I'm just going to end the polling and share results.
Okay, so wonderful. 47% say that they can see themselves or someone from their organization using the platform to help in their FLS efforts. And then sort of a tie at 20% for those who say some resources or tools could be helpful, and those who are unclear with how they could use the information. And then lastly, those who would require further assistance. So thank you so much, everyone, for providing that key feedback. It's very useful.
So thank you so much, Geneviève. So as mentioned at the beginning, I think at this moment, I'll invite my colleagues to turn on their cameras, myself as well, and we'll have a little bit more of a roundtable discussion, question and answer period. I'll try my best. I think we do have some Q&A questions down at the bottom there, so we'll start with those. But if you have raised your hand, or if you would like to raise your hand, I could also allow you to talk. And then we could even hear from you with your own voice.
Chloe, I'm just going to start by saying that the Q&A questions have been answered.
Okay.
Judy was asking about if the reporting that, you know, in the self-assessment tool, if that's confidential, and then Geneviève answered that already. And Judy was also asking earlier if there's going to be some handouts and regarding the platform, and I answered that. So for everybody who wants to know, there's going to be a handout coming out. There's also this is, as you know, being recorded, and everything's going to be on our community of practice website that Chloe was showing at the beginning.
Thank you, Annie. I didn't realize that they had been answered, so thank you for that. So to start the roundtable discussion, I see someone in the chat or in the participant list has a question with their hand up, so I will let Dee, I will allow you to talk, and you just have to unmute yourself to ask your question.
My apologies. I think I accidentally clicked something.
That's okay. So if you don't have a question, we can just go to the next question, no problem.
If there's no question, Chloe, can I just ask a question? Although I kind of know the answer. Geneviève, when we looked at the polling, the last polling, there was like I think 14% that said they could use additional support, or they would require additional support. Can we talk about that a little bit? As a member of the entity, I can say that we would welcome any request for additional support. We're hoping to be able to start using the platform with certain providers, so anybody who wants to give it a try. And Geneviève, I'll let you answer if there's other supports out there as well. And what's the recommendation for implementation for a service provider that doesn't know where to start with the platform?
So for additional support, as Annie mentioned, the entity, so we've worked closely with the entity for several years now, basically since inception. Chloe and Annie have been very instrumental in working with our key cohort of networks or organizations that are familiar with the platform and are there and available to support organizations in the implementation process. So you definitely have access directly to the entity if you need that support, or if you sort of want to go through a more formal process. We do have a form online on the eQUITY Link website where you can specifically ask for implementation support and identify your regions and give us an idea of what type of support or what are your current challenges, and then we will direct people to the appropriate support. And for organizations who are unsure where to start, I think the best thing is start with equity fundamentals, because it does link off with the different resources. You'll be touching and linking off to the active offer training when it's appropriate. Same thing for the HHR strategy or health human resources strategy. So it is meant to sort of provide that overall view, and doing the self-assessment, even really it's for your information only. As I mentioned, there is no, even I as an administrator have absolutely no access to that information. It is strictly meant to be a guide, so that you can see what you've currently accomplished, what you're currently working on, and what hasn't been touched, so that you can look at that information and ideally with a group, like a steering committee, along with different partners and key stakeholders, including Francophone community representation, look at what is currently feasible for your organization. So really taking it step by step, looking at what's possible for your next steps and tailoring it to your current needs and capabilities. We do know that it is quite an interesting time to be implementing various strategies. Some things might take longer due to current circumstances, and other things some committee work can actually, like, if it's done through Zoom calls or different strategies, it can move fairly quickly. So looking at those, what is really able, what you can do as an organization, and just dividing it step by step, one step at a time, things that are feasible. And ideally, we hope that you choose ambitious but realistic goals to help just bring yourself slightly further along in your French language services journey.
Thank you so much, Genevieve. I don't see any other hands up, but I do see Annie's hand, so go ahead, Annie.
I just wanted to touch also on something that Genevieve said. She mentioned the accreditation, like the, I'm not even going to try to say what it was, but she also talked about the designation criteria for Ontario. And if you're not familiar with those, the agencies around the call who are identified agencies, if your agency is identified to provide French language services, then you actually know of those criteria because they are the ASI questions. So if you are in the process of doing your ASI reporting, when Genevieve's talking about the designation criteria, these are the same questions that you have in section 4 of your ASI reporting. Just pointing that out.
Excellent point, Annie. And yes, so it is there to help you look at if you're having trouble implementing or addressing a certain criteria or meeting a certain criteria, apologize. Then you can look through the different strategies, see what are the tips, the tools to help you implement those so that you can meet your criteria based on your level, whether it's if you're a designated or identified organization. And overall, those are the criteria that are for Ontario's French language services in health for healthcare organizations. So they are key criteria to be striving towards.
Thank you, Genevieve. So again, if you have any questions, if not, then we'll just keep talking. That's fine. But if you have any questions at all, you can click the participant button at the bottom, and then at the bottom of the participant list, there should be a raise hand option. And at that moment, I can allow you to talk and you can ask your questions. Or if you'd like, you can ask them in the Q&A or in the chat. I'll leave a few more minutes. I do have a message saying that there's no other participant, there's no participant button. Okay. Let me see if I can potentially change that. If not, you can also just put in the chat that you would like to talk, and I can allow to talk at that moment as well. Thank you, Maggie.
And maybe while we await to see if there are other questions, I was just being mindful of time, but I guess I could have taken the extra 5 minutes, but I will maybe just talk about it quickly. Once you've completed the plan on the online tool, there is a print version that you can either download as or save as a PDF or print out, and that's the mechanism to. So it takes all of your strategies. It'll take the actions, the person who's responsible, your start date, anticipated date, and present that in a table format for each of the different sections. Along with where you're currently at with regards to your progress data. And so that is the way that we offer organizations to be able to share those plans if they wish with other stakeholders or organizations. And it's quite easy to copy and paste information from your current documents, or we have other organizations that have been piloting this where they've just taken some of the information and copied and pasted in their current plans. So it can work both ways.
Thank you, Genevieve. It doesn't seem like we will have questions. However, we can stick around for any questions that might come up. I have one thing to say, which would be that it's as mentioned by Genevieve and Annie. We're very excited about this platform. We honestly call it, I like to call it a little hub for French language health services and the guiding criteria. And it is really just a little a website, a hub that hosts just a slew of resources and criteria, and just it really hosts everything that you need to help with the planning and development of French language health services for multiple organizations, as Genevieve presented, whether you're frontline or whether you're an organization background management position. And such, and the entity, as Annie mentioned, is here to guide you if you ever need any resources. I will share my screen again with a thank you note as well as our contact information and the QR codes again for the website and the membership, in case you didn't have time to scan those or anything. So, but I did want to mention that it is something that the entity is very much open to helping you with. If you have any other questions or if you need any guidance at all. I did see Annie's hand again, so I will allow her to
Thank you. I just wanted to say before we leave that, like as Genevieve was saying, if you're not certain where to start, or if you are going to use the platform, I would recommend to go through the self-assessment and don't hesitate to go over things that you might think are completed in your organization. In other words, if you feel you are you have implemented services and you're at the evaluation step, I think it would be a good idea to go through all the other steps just to make sure that if there's not other strategies. And as Genevieve mentioned at the beginning as well, it's a bit of a cyclical thing. So there's nothing pertaining you from going back, even if you're a little bit more advanced. We're continually learning and improving. So that would be my recommendation. But my number one recommendation would be, if you have a French language services committee or a group or a person who's responsible for that, to do the self-assessment as soon as you can, to put the time aside to do that, and don't see it as the whole mountain. There is a huge quantity of content. Not all of it is relevant to your organization right now, so you don't need to. The self-assessment is going to help you decide content you're going to look at right now, and the rest you can put aside. You don't need to absorb all of that in one shot. But because since I've been working in this capacity, the number one thing that I hear is we do not know where to start. And it's the first time that I feel like it's very easy, do the self-assessment. It's the first time that we have an answer that I'm confident is going to make a difference. If you don't know where to start, do the self-assessment. That's my message.
Thank you for your public service announcement, Annie. And Annie hasn't said this yet, but she often calls this this platform a game changer, which I very much agree with. So I don't see any hands still in the participant list, so I will share my screen for the concluding slide. One thing before you all start to drop off the call is one thing we would really love to mention is that we do have a survey after you exit the Zoom. There should be a survey that pops up. Please take the time to answer these questions. It would take probably between 30 seconds and a minute, and it will help us with further improving our webinar delivery as well as content and just understanding how you feel about the platform, etc. But I would like to thank Geneviève again for presenting the platform. She did an amazing job, and it really was, again, it's an awesome platform, and we really do thank you for your time and creating the presentation and such.
Well,
so
thank you so much again for inviting me.
And thank you to all the participants who showed up today and really showed engagement. And the webinar will be was registered and will be posted again, as Annie mentioned, to our website, as well as will be shared with you. The slides will be shared, as well as a one-pager quick facts, quick information for the platform if you have any questions. And again, feel free to contact us, myself or Annie, or anyone really within the French health world, but myself and Annie as health planners and facilitators are here to help you and guide you in this process for the HNHB and WW regions. So those are my concluding words. As Annie always has to have the last word, I'm not sure if she has any concluding words. Perfect. We'll stick around for the next few minutes and see if you have any questions. But feel free to start dropping off the call if you'd like.